and therefore they have no reason to be in office. Don't tell us what you have done, because Kenyans who have received the services they want to say that indeed they enjoy the social health authority, not you. But in any case, we are the practitioners who are in the periphery. Mashinani ni kubaya. Nothing is working. So why is it not working? It's because of the bad leadership.
Solidarity forever. Solidarity forever. Solidarity forever. For the union makes us strong. Solidarity forever. Solidarity forever. Solidarity forever. For the union makes us strong. Tabibu power. Power. Tabibu viva. Viva. Afya power. Power. Afya power. Power. Shaka-tails must fall. Fall. Shaka-tails must fall. Must fall. Very well. They will fall. Very well. So my fellow comrades and leaders, the members of the 4th Estate, good morning. Today, we are here, and before I say much, I must say that we are here to reiterate that our call to go on strike as from the midnight of Sunday, the 19th day of January, still stands. And this is because we have not seen any serious indication that our employers are taking us seriously. I heard the other day the CS saying that in terms of one of our grievances, which is the Social Health Authority, exclusion and discrimination of clinic officers, that it has been resolved. And we want to state here categorically that that issue is yet to be resolved. There is no clinical officer as we stand here who can pre-authorize. There is no facility that has been empaneled, and we are still unable to see Kenyans through the Social Health Authority. We have seen the resolution that was done, and we thank the Council of Governors for taking the initiative and communicating their directive and in support against the discrimination. But the players and the people who have to make the decision and implement that, the Social Health Authority, we know they don't have goodwill and they have not implemented. So we want to communicate to the CS that that has not been done, and so for us, because we are not here for promissory notes, we are only going to take substantive solutions, and that means when it comes to the Social Health Authority, we want to see the pre-authorization rights given back to clinic officers. We want to see the list of facilities registered by the Clinic Officers Council uploaded on their website as empaneled facilities, both the facilities and a list of clinic officers. So that grievance is still outstanding, though we commend the Council of Governors for their initiative. It seems the Ministry of Health, it is still unwilling. And for that, the strike is still on. The second issue about the breach of return to work agreement, as we are speaking today, we have 94 officers, clinic officers and laboratory technicians. They have worked under contracts called Global Fund for about 11 years. There was a decision taken that they be absorbed from the Public Service Commission, while the Ministry of Health absorbed those who are under them, those who are under the county governments, 94 of them have been working for the past 6 months without pay and without knowing their fate. And if you remember, early last year, one of them fell into depression and died. And we are not ready. We are not ready to lose another one because of the neglect from the government. So if for anything else, we are not going to go back before these officers are absorbed and together with the UHC. Because we have reached a point where on the government side, it has been all talks and empty promises. You have promised that they are going to convert UHC, but when we look at the budget that is supposed to be read this June, there is no budget to convert the UHC. And so we have told them, and we continue to ask them, that we must see tangible steps towards that, and that means we must see a budgetary allocation towards the absorption of the universal health coverage staff. Many counties, as we talk, they either do not have a medical cover by the employer, and if they do have, a good number of them, they are useless. You cannot be seen in any of the facilities using them, and for those who are seen, they have a capitation that is even lower than that one of the Social Health Authority. Yet it's supposed to be a comprehensive cover as directed by the SRC, which gave a circular directing what a comprehensive cover means. The issues of CBA, they are still outstanding. Yes, we have a way forward on how to resolve that with the Council of Governors. The excuse has been that we do not have an SRC in place. Now we have an SRC in place. They were passed by the National Assembly yesterday, so there is no longer any excuse. And it's because of this, and given the background that in the first instance, we went on strike because the employers, the 48 of them, the Ministry of Health together with the 47 county governments, they refused to honor the orders of Employment and Labor Relations Court to negotiate and conclude a CBA. That was before April. That was the first reason as to why we went for the last strike. The strike was also resolved by the same court through a return to work agreement that is registered in court and registered by both parties, being the union and the employers. But then the same people are again in breach of that return to work agreement. So we have sufficient evidence that they neither listen to the courts nor honor any agreements. And that is the reason, and I think the message that we are giving today is that we are no longer taking promissory notes. From Monday, we shall be on strike, and we are not going to come back with any other agreement. We want to see promotion letters given to our members. We want to see Global Fund clinic officers and their counterparts given letters of absorption. We want to see a budgetary allocation for absorption of universal health coverage staff as from July of this year. And we want the CBA concluded and registered in court before we can go back to work. So that is the message that we are bringing here today, because I know that there are some centers who are trying to mislead, saying that we have resolved the issues that were taking us on strike. There is none of those issues that have been addressed. Allow me to invite the GS to also give his remarks.
Okay. Thank you, Chairman, and the leadership present, members of the press, and Kenyan. Comrade power! Power! Comrade power! Power! Thank you. I want to unequivocally affirm the position that the chair has already stated, that our strike remained in force. And as you may know, and we have been trying to clarify that the strike that we have is a making of the government. It is similar to the same strike that we had last year, because then the government had revised the payment of our intern to their disadvantage, creating a problem where there was none, and also failing to implement the agreement then. Again, we issued this current strike notice for 14 days with the similar issues where the government has violated the laws and orders, especially on the Social Health Authority, where there was no problem. So they have created problem. And our understanding is we didn't have this under the NHF at the period of transition, so they created this. Unfortunately, they have more problem to address rather than actually pulling us to a problem that need not to be there. We gave them 14 days window period to ensure that if they are keen, they will have addressed the issues which are there, because none of the issue and none of the government have said that there are issues that cannot be addressed. I mean, our issues have not been rebutted by any employer by saying that they do not exist, or even they have no ability to address them. Now that they have ability to do it, and they are not willing to do it, that is why we have resolved to actually go on strike, to agitate and ensure that they can do the right thing. Let me, as I do that, appreciate the Council of Governors for at least for being proactive for the first time under the current leadership, because their previous leadership, who was the chair then, we never saw such a thing happening. And we were able to sit, discuss on a number of issues, and we made it very clear that the return to work we have is a document that is registered in court, meaning it is a court order that ought to be implemented as we agreed. And they sought not to do it, meaning that they have violated the court order. So therefore, our strike is about enforcement of the court order and nothing else. On the issues that we had already discussed, and we presented a position in terms of what the law provides on the Social Health Authority, on the two issues that we are alleging discrimination for our professional and facility owned by clinical officers, the Council of Governors found it that indeed we are on the right history, we are on the right side of the law. And they wrote to the ministry, where the participants were present from the ministry, and they signed the same document communicating that they resume where they had departed from the practice of the law after the transition. Unfortunately, I must say it, that we, the clinical officer, a day after, we were shocked to see the CS calling for press, parading the Director General and also the Social Health Authority CEO to tell Kenyan that there is no problem, and yet we are raising we are saying that there is a problem. And I must say, if you go through their statement, the intention was to rubbish the agreement that they had signed with the Council of Governors. Because if you listen to what the CEO of Social Health Authority said, it was very clear that they are not going to empanel facilities owned by clinical officer without going through the KMPDC. And then they affirm that indeed our issues have not been resolved, and they are pushing us to go on strike. If they have decided, as people who have sworn to protect the law, that they are going to violate the law, and we as law-abiding citizens, we have said we are not going to support them or partner with them to violate the law. We will stand on the right side of the law to protect the law and ensure that clinical officers have their freedom to practice in accordance to their qualification, to be empaneled, and to practice as such, because no one should be able to ignore the law. Our appearance here is actually to tell the President that he should not entertain people who have openly violated the law, and they expect that is the good leadership we expect to see from this government. These people should leave for offices. The CS, the CEO, who I saw in the press the other day, the chair of the Social Health Authority, and the Director General, who is the highest ranked officer, who is the technical advisor to the government on matters of health. They are misleading the government and they are misleading Kenyan. And in any case, they are the problem why Kenyans are complaining about the Social Health Authority. And therefore, they have no reason to be in office. Don't tell us what you have done, because Kenyans who have received the services are the ones to say that indeed they enjoy the Social Health Authority, not you. But in any case, we are the practitioners who are in the periphery. Mashinani ni kubaya. Nothing is working. So why is it not working? It's because of the bad leadership. Now let me end there by saying and affirm that we do not celebrate going on strike, but a strike that has been orchestrated by the government, and they are not willing to step back and enforce the law. We have no choice but to go on strike, because as the chair has elaborated very clearly, the issues of promotion have not been done. It had timeline. The issue of transitioning our people to permanent and pensionable had timeline. There is no indication that that is happening. The issues of the CBA conclusion and filing in court has not happened. So therefore, we will not be a conduit of anyone willing to break the law. We will stand on the side of the law. And therefore, we call upon Kenyan to support the cause by clinical officer, and also to inform those who have patient in the public facility or will be seeking services or have appointment with us that we will not be there starting Monday next week, that the strike shall begin unless otherwise, because I believe one day is too long. One day is too long for government which is serious with its people to change the course and ensure that services will continue uninterrupted. But because they are the one who want people to go on strike, I expected that they will do nothing and they will push us to go on strike. Asanteni. Nitataja tu machache kwa Kiswahili kwamba kama maafisa tabibu tumesukumwa kwenda kwenye mgomo na serikali ambayo ipo. Serikali kwa kupenda kwao wameamua kutofuata sheria zilizopo. Wamekataza kwamba sisi kama maafisa tabibu hatuwezi kuendelea kutoa huduma kama ilivyokuwa kitambo, na kama vile sheria inavyosema wametukataza kupitia kwa kukataza ama kusajili zile hospitali ambazo sisi ni zetu zaidi ya 1,100, zote haziwezi fanya kazi kwa sasa ama kuwaona wagonjwa ambao wako kwa Social Health Authority. La pili, maafisa tabibu ambao ndio wengi wamekatazwa pia kuona wagonjwa, na wanaambiwa watumie namba ya mtu mwingine ama sajili ya mtu mwingine kuwaona wagonjwa. Na sisi tumesema hatuwezi kubali kupewa hiyo order ambaye ni kinyume na sheria na sisi tukaifuata. Na ndio maana tumesema tunaenda kwenye mgomo ili kusudi waweze kubadilisha msimamo wao ambao unakinzana na sheria, na pia wamekataa kutimiza maagano yetu ya mwaka uliopita, na tumesema kwa sababu hawajafanya hivi vile tulivyokuwa tumekubaliana kwa muda ambao uliokuwepo, haso kumaliza ile CBA yetu kwa siku 60 haikufanyika. tuko zaidi ya siku 100 zaidi na hawajaweza kufanya hivyo. La pili, promotion ama kupandisha vyeo vya watu wetu wale ambao wamekaa katika cheo moja zaidi ya miaka 10 wako huko, na serikali bado zile, na mpaka nitaje na niseme serikali kuu kwa kweli wameshapandisha watu vyeo, lakini serikali za gatuzi nyingi karibu zote hawajaweza kufanya hivyo. La mwisho ninasema hivi, licha ya kukiuka sheria na vile zote ziko, serikali ina matatizo ya kutosha ya kuweza kushughulikia, waache kutengeneza matatizo ambayo hayapo. Kwa hivyo hii mgomo ni kwa sababu serikali imeutengeneza, na sisi tutaenda kwa sababu wametuita kwenye mgomo, tutawajoin huko. Na pia matatizo yanaongezeka. Kwa sasa tuko na interns wale ambao wamekaa zaidi ya mwaka mmoja ambao hawajakuwa posted. Haiko kwenye ile ilani yetu ya mgomo, lakini vizuri tutaje kwa sababu hatujaona ishara kwamba wanataka kuwa post. So priorities za ministry haziko sawa, na tunasema kama wananchi hatutaendelea kuvumilia katika matatizo, kwa sababu matatizo yakiletwa na serikali lazima tuyapinge, kwa sababu tumewapatia idhini ya kuturahisishia maisha. Asante.
Asante sana. Uongelee vile wagonjwa wanaambia. Is there a lady who wants to Aran? It will be evidence we tried inclusion. Yes? Questions? Okay. Very well. The other day, the country was treated to a spectacle where patients had to walk from KNH all the way to the CS's office. I must say that that was a moment of shame, not only for the CS, but also for this government. We have been talking about the inefficiencies under the Social Health Authority for the past 4 months. The fact that they never took a step until when desperate patients would come, irrespective of their suffering, to look for the CS themselves, I think it was a very low moment for our country, and I think it speaks volumes. Now, let me simplify what we are talking about in terms of Social Health Authority, and especially the impact to our patient. For a clinic officer to be able to see a patient through the Social Health Authority, the Social Health Authority must recognize that clinic officer. How do they recognize them? They recognize them through empanelment. Empanelment is including them in the register of the recognized practitioners. They cannot do that until the time they can be able to recognize the person who gives you that registration certificate and the license. And that is why, by the dint that they didn't recognize the clinic officers council, then they cannot recognize the clinic officers, because the registration and licensure comes from the clinic officers council, and you cannot recognize an individual practitioner without recognizing the regulatory body that regulates them. And that is the same with the facility. So for you to be able to pre-authorize, the authority must recognize you. The recognition is through the empanelment. Empanelment means enlisting you as an eligible practitioner to see patients on their behalf. What is the downfall? What is the downside of that? In this country, as we speak today, if you go to the oncology centers, the oncology specialists that we have, 90% are clinical officers. When you go to ophthalmology and cataract surgeries, 90% are clinical officers. When you enter any outpatient department today, the people who are going to see you are clinical officers and many other specialties. When you go to the Social Health Authority policy and regulations, they tell you that you cannot go to level 4 before passing through level 2 and level 3. Who are the clinicians there? It's clinic officers. So when clinic officers are not recognized, are excluded, are not allowed to see patients through SHA, there is no Kenyan who can be seen through SHA. And that is why Kenyans are saying SHA is not working. That is why they are refusing to register with SHA, because they do not see any benefit. And that is why we have been telling the president, and we even wrote a memorandum to the president. And I wish the president can give us an ear, because we want to help him. That is why we are telling the president that the biggest obstacle, the biggest threat to universal health coverage is the Social Health Authority team that he has put there, together with the extension of the cartel in the ministry and in the Kenya Medical Practitioners Council. And I think at some point we have to be candid. And we have to say that there is no difference between the leadership of the Ministry of Health and KMPDC and now SHA. And decisions that are supposed to be policy-based and that are supposed to be made by the CS and the PSS and the leadership of the ministry concerning SHA are being made at KMPDC. And that is where the head of the cartel is. So basically what we are saying is that we are speaking and advocating for the Kenyans' well-being. But now when it comes to the 19th, because we know people are going to suffer, we do not have any other option. Their government has let them down. We must get out and fight. And I want to encourage patients, and I want to commend those patients that took themselves to the CS. I want to encourage Kenyans wherever you are. Even if you are not a patient, you have a patient. And if you're not a patient today, you will be a patient tomorrow. Let us go to the SHA offices. Let us go to the offices of the leaders that we selected. Make them explain as to why we are unable to get services through the Social Health Authority. But as Kenyans, we must ask of the people that we have elected, of the offices that we have established, that they must deliver their mandate, and while doing that, they must do it as per the prevailing law. When you look at the Social Health Authority Act, Social Health Insurance Act, it mandates that board, the Social Health Authority, to recognize all the regulatory bodies. But some people, of course led by their cartelism and selfish interest, they decided they're only going to recognize KMPDC because of two reasons. They want to extort money from the other facilities not registered by KMPDC, because when you force people to go and pay money for licensure and registration to a body where they are not mandated as per the law and against the law, that is extortion, and it's being facilitated by operatives in the Ministry of Health and in the Social Health Authority. When you force clinic officers to pay for a medical officer's license to pre-authorize for a procedure that that medical officer cannot do, that is extortion. And this is what we are calling corruption. Asante. Wacha niachie hapo.
Kuna swali?
Huh? Yeah. The quality of care bill is part of the connivance of the cartelism. And I'll tell you why. They are telling that they want a quality of care bill to establish a quality of care board for the accreditation of the facilities. They are trying to lie to the president, to parliament, and to others that there is a gap in law. There is no gap in law. What the Social Health Insurance Act provides is that the Cabinet Secretary shall designate an accrediting body for quality of care. How does a Cabinet Secretary designate that? They do that through the regulations. If you go today and read the regulation, the Cabinet Secretary already did that and designated the regulatory bodies that register and license these facilities as the accrediting bodies. And so there is no lacuna, there is no gap in law. The only reason they are doing this is because they want to buy time, they want to create confusion, they want to create an artificial problem so that they can benefit from the confusion that is happening. But actually, the quality of care bill is not necessary. And I know they are going to table it in Parliament, and that is our first memorandum that we are going to do there, that we do not need to over-legislate to a multiplication of some institutions that do not even work. We have enough institutions that can do the work. We only need people without selfish interest, Kenyans of goodwill, people who are intelligent enough to know what UHC means and its implementation, and then we'll be able to take the country forward.
Yeah. I hope you have understood. The chair is saying we have two institutions in the Health Act. The KHPOA, that's the Kenya Health Professional Oversight Authority, which have a similar mandate that they are proposing under that thing you are talking about. But also remember the president, when he came in, he launched another institution called what? The KHRAC. What have they done? And this was specifically also to aid issues of quality of care. So I think those are the questions you should be asking them when you have them in the meeting, because they will not even be able to explain. They are confusing Kenyan that there is no law, but I think the law we have is enough actually to guarantee quality of services and to guarantee continuum of services. Unfortunately, they are the ones who are causing interruptions. Allow at least a statement from one of us who owns a private facility, and he can actually give his position.
So thank you so much. My name is Stephen. I am a clinical officer in this nation with a clinic registered by the Kenya Clinical Council. So I am a frustrated employer in this nation because we have specialized in cardiology, and we see patients who have heart problems, which form the bulk of our patients in our facilities. My clinic is in a county where we have a very, very vast county. Within the town center, we have one referral hospital, which is a level 5, and no level 4 or level 3 facility. And therefore, the private clinics that are there offer the level 3, level 2 responsibilities within that county. Now, if you look at the Social Health Authority program, patients are not able to get outpatient services from a level 5 hospital with this insurance cover. And therefore, the private hospitals end up now offering these services to our patients. So we are a frustrated lot because we have patients who are suffering and they are not able to access care because we have not been allowed to offer services to patients who have been registered by the Social Health Authority. I will draw a scripture from the Bible, the book of Proverbs 28, verse 3. It says, when a country is rebellious, it has many rulers. But a ruler with discernment and knowledge maintains order. We are in a country where there is a lot of rebellion because we have many rulers who don't understand what they do. We need a country with a leader with discernment so that he can impose order, especially in the people that they serve. Thank you.